Hello and welcome to our virtual New to Medicare workshop. My name is Betty Brickhouse. I am a Medicare counselor with the Central Virginia Alliance for Community Living, and it's my job to help make Medicare clear to you. And hopefully within the next few minutes you will come away an expert in Medicare, knowing exactly what your choices and costs are. So today we're going to cover some basics about Medicare. We're going to talk about your mail, what to open, what to toss, and how to know the difference between those. We're going to talk about the nuts and bolts of Medicare, how Medicare works, what your choices are with Medicare, what makes it so complicated, and what the costs involved are. If you're turning 65, this mailbox might look familiar to you. Stuffed with things from every different company that you can imagine. And the question is, what's important? What do I need to keep? What can I toss? And how can I keep my house from being overrun with all this mail? So the first thing that you want to look for is the Social Security logo. The Social Security is the department that determines eligibility for Medicare. They are the ones that decide, look at your work history, make sure that you've had 40 quarters, which makes you eligible for Medicare, and then they are the ones who sign you up. If you're going to sign up for Medicare, you would go to the socialsecurity.gov website, and they are the ones that can answer any of your questions about signing up for Social Security. So if you get a letter in the mail with this logo on it, open it. It's from Social Security, and it has something to do with your eligibility for Social Security. The Centers for Medicare and Medicaid Services is a department that administers your Medicare. So once you're signed up for Medicare, you will get mail from CMS when it pertains to the administration of your Medicare. They are the ones who are going to send you your Medicare summary notice that tells you everything that Medicare has covered, what they've paid, what's left for you to pay, or your Medicare supplement to pay. So anytime there's information about your medical coverage, you're going to get that from CMS. So you're going to want to look for that logo. And then finally, there's the Department of Health and Human Services. They are over Social Security and CMS. And so any of this mail that you get may have the Department of Health and Human Services logo on it. And if you see that, you know that it's from the government, you know that it's real, and you're going to want to open it. So those are the three logos that are the indicators to you that it's official mail and that's something that you're going to need to read. These are all things that look semi-official but aren't. These are leads for insurance companies, and if you sign them and send them back thinking that, oh, I need to know the latest news on Medicare, what you will get is a lot more mail. So it's up to you, but my advice would be to put those in the trash where they belong and just communicate with the federal government. So this is an example of a letter from CMS. You can see right there the logo for the Department of Health and Human Services. So you know right away this is something official. Then you also see the Centers for Medicaid and Medicare Services on there. Oh, that's another indication that this has something to do with your medical coverage. So let's begin by talking about original Medicare, that Medicare that began in July of 1965. So Medicare, original Medicare, has two parts. Part A, which is hospitalization, and Part B, which is medical. Part A is fairly straightforward. It is any time you are an inpatient in the hospital, the rules of Part A are going to cover you. By inpatient, I mean that you are admitted to the hospital. It doesn't mean observation, it doesn't mean emergency room, it doesn't mean ambulance. It means that you are an inpatient in the hospital and the doctor has admitted you. Sometimes it's a good idea to make it clear with the doctor whether or not you've been admitted or you're in observation, because there are going to be two different sets of rules that will cover you. But inpatient hospitalization, and that includes things like hospital services and supplies, a semi-private room, all of those delicious meals that you'll be receiving, general nursing, the nurses who come in and check on you in the middle of the night, and any drugs or medications that are part of your inpatient treatment, as opposed to those medicines that you bring in from home that you take on a daily basis. It covers end-of-life care, hospice care, and up to 100 days in a skilled nursing facility. Now, Medicare does not cover long-term care. It will not cover someone for a long period of time in a skilled nursing home. But let's say if you have gone to the hospital for a hip replacement and you're still not quite ready to go home, you need a little rehab, Medicare will pay for up to 100 days in a rehab facility to get you back and up and on your feet. 100 days during a benefit period. Now let's talk a little bit about benefit periods. With Medicare Part A, there is a 60-day benefit period that's going to be covered. What that means is 60 days after you've been released from the hospital or a skilled nursing facility and you're home for 60 days, you're within that same benefit period. On day 61, you begin a new benefit period, and at that point you pay a new deductible, which we'll talk about in a minute, and you'll also have 60 days worth of new benefits. So that's a little bit different from the way a traditional insurance often works. So hospitalization, let's talk a little bit about the costs there. Part A comes with a $1,484 deductible. It's not a one-time-a-year deductible the way insurance often is, but it's per benefit period, and we just discussed benefit periods, which is 60 days after you've been released from the hospital, you're home for 60 days, and a new benefit period begins. If you went back into the hospital, you would pay that deductible again, and you would have a new benefit period for your benefits. Medicare Part B is everything else, everything that happens to you when you're not an inpatient in the hospital. So that's going to include things like your doctor visits, outpatient care, any kind of outpatient surgery that you might have when you're not staying overnight and being admitted to the hospital. Cataract surgery, for example, would be an outpatient service, and that would be covered under Part B. It covers some home health care, your durable medical equipment like wheelchairs or walkers, and a whole long list of preventive care. Preventive care is something that was introduced to Medicare through the Affordable Care Act, and it is in an effort to keep you healthy. So things like colonoscopies, mammograms, PSA tests, a lot of screenings are paid for 100% by Part B. You don't have to pay any deductibles or any co-pays for those. Of course, things that aren't covered by Part B would be hospital visits, skilled nursing, and hospice care, which we've already talked about under Part A. It also doesn't cover dental, vision, or hearing. Like most traditional insurances, those are separate products, and if you want to have dental coverage, you can purchase it, but it's not going to be covered under Medicare. The one exception there is any medical issues that you have with your eyes. So I've already mentioned cataract surgery, glaucoma, macular degeneration. Those are all conditions that you would see a medical doctor for, and Medicare will cover those under Part B. What it won't cover is annual visit for a pair of glasses. It will also not cover hearing aids or hearing or any kind of dental. Medicare Part B does not cover prescription drugs that you would pick up from a pharmacist, but it does cover any kind of medication that is administered in a doctor's office. So if you have some sort of infusion or shots that are administered in a doctor's office, Medicare Part B will cover that. Otherwise, anything that you pick up at the drugstore will be under your prescription drug plan Part D, which we'll talk about it in a little bit. So what are the costs involved with Part B? Well, there is a monthly premium of $148.50, and that will come out of your Social Security check if you're drawing Social Security. And if you're not drawing Social Security, they will bill you monthly for that $148.50. There is also a $203 deductible. And unlike Part A, that deductible is one time a year. You pay the first $203 of any kind of Part B service, doctor's visits, x-rays, tests, those sorts of things. And then Medicare is going to cover 80% after that, and you are responsible for 20%. As I've already mentioned, wellness visits, you pay nothing. Those are covered 100% by Medicare as our preventive coverage. So there also is something to be aware of. It's called an income-related premium, an IRMA, and that applies to people whose income are in the higher levels. So if you're single and you have an income anywhere between $87,000 and $109,000, or if you're married, the income would be $174 to $218. Your Part B premium is going to be $202 instead of $148, and they will add $12 to your Part D. And you can see on the chart here that that goes up with your income. Sometimes people get caught in these IRMAs if they're retiring, and the IRMA is based on your income 2 years ago, the last full tax return that was in. And so if you went from high income while you were working to a lower income when you've retired, that IRMA may catch you for a couple of years. But once your income tax show that your income has been reduced, the IRMA will disappear. There is an appeals process to that if you think it's unfair. Sometimes people make big withdrawals from their 401k, for example, and that will affect the IRMA. There is an appeals process you can go through if you think it's unfair, but do know that if your income falls, once that income tax, they're going off that year's income tax, they will remove that IRMA. Sometimes the costs of Medicare are a little hard on individuals who have lower incomes, and so Medicare has two programs that help those individuals. The first one is called a Medicare Savings Plan, and that is a program that you apply through social services to receive. For those individuals with incomes under $1,084 or couples with an income under $1,457, they would qualify for a program called Qualified Medicare Beneficiary, or QMB. And what that is going to do is it's going to pay the $148.50 that is the cost of the Medicare Part B premium. They'll pay that for you. They will also pay your 20% copay when you go to the doctor, and the $203 deductible for Part B. So it's going to pay all of your medical expenses for you. It will also keep the cost of your medicines down to $3.70 for generics, or $9.20 for brand names. For those with incomes up to $1,456 for an individual or $1,960 for a couple, they would qualify for a Medicare savings plan called Qualified Individual. And what that is going to do for that individual is pay the Medicare Part B premium, the $148, and again keep the cost of the prescription drug plans to $370 or $290. We'll also cover up to about $33 for the prescription drug premium. For individuals whose income is a little higher, $1,608 for individuals or $2,177 for couples, they can apply for something called extra help or low income subsidy. It's the same thing. And what that will do is help with the cost of their prescription drug coverage. For people at that level, there is a sliding scale, but with the full extra help, it will cover the cost of the medications up to $3.70 for generics and $9.20 for individuals, and also help pay the premium. So that's through Social Security. These are worth thinking about if you fall into those income levels, because it would certainly help put a little money back into your pocket. So now we're going to move on to Medicare Part D, or the prescription drug plan, and that started in 2006. It's had a reputation for being quite complicated, but it's not too difficult to understand. There are phases that the prescription drug plan goes through, and the first phase is the deductible phase, and most of the prescription drug plans, and these prescription drug plans are run by private companies: SilverScript, Anthem, Humana, Aetna, to name a few. But they're tightly regulated by Medicare. There are a lot of differences between Medicare prescription drug plans. There are differences in what the monthly premium will be, what your drug copay will be, the preferred pharmacies, and so it can be complicated choosing those plans. And I'm going to give you a little hint in a minute about how the best way to go about choosing those plans are. But first I'm going to explain how the prescription drug plan works. Most plans have a deductible of $445, although that will vary from plan to plan. The highest deductible that's allowed in 2021 is $445. Now that deductible generally applies to name brand medications. So if you're taking an expensive name brand medication like Eliquis, you would pay the full cost of that medication until you reached $445. And then the plan would kick in and start covering it. For generic medications, typically, but not always, the plan does not require you to meet that deductible. So it will start paying on your medications immediately. So don't let that deductible scare you if you're taking maintenance generic medications. Most likely those medications will be covered from day one. Once you've met that deductible, you enter what's called the initial coverage phase, and in that phase you pay a copay. So for that Eliquis, the first month or two you'll pay the full cost of it. After that, you'll have a copay of maybe $40, $50, depending on the plan. And that's a standard amount that you'll pay each month. For some medications, for some specialty medications, instead of having a standard copay, they will have what's called co-insurance. And the co-insurance would be a percentage of the full cost of that medication. So if you had an expensive medication that was $1,000 a month, you might pay 50% of the cost of that, $500 a month, and then your insurance would cover the other 50%. Once you reach $4,130 out of pocket that you've spent on your medications, you enter what's called the coverage gap. And when you're in the coverage gap, you pay 25% of the cost of the brand name. So for that $1,000 medication, in the coverage gap, you'd pay 25%. So the cost may go down, $250 instead of $500. And you'll pay 25% of the cost of your generic medications. That may go down as well. If your generic medication was an inexpensive statin that cost 75 cents a month, you'd only have to pay 25% of that month, and the cost of that may well go down. You continue in that phase until your out-of-pocket has reached $6,550, and then you enter what's called the catastrophic coverage. And at that point, you pay 5% of the cost of your medication. So the cost of that $1,000 medication that you might have been taking will go way down once you enter the catastrophic phase. So those are the phases that you go into. However, if you're taking basic generic medications, that's not something that you'll ever have to worry about. The phases primarily affect those individuals taking expensive brand name or specialty drugs. Now, I told you I was going to tell you an easy way to find a prescription drug plan that might work for you, and that is on Medicare.gov. And you can go on to Medicare.gov, you can make an account, or although you can go in and just shop without an account. Medicare.gov allows you to put in the names of your medications, the pharmacies where you like to shop, or you can include all the pharmacies to see where the cheapest one will be. And then it will give you a list of the prescription drug plans that are going to cover you the best at the lowest cost. The plan that you choose may be different from the plan that your spouse chooses or your neighbor chooses. The prescription drug plan is specific to you. And it's a good idea every year from October 15 through December 7th to check that prescription drug plan to make sure that you are still covered and that you still have the best plan for you, because things change. The premiums change, the copays change, the deductibles change. So it's a good idea to check that every year at Medicare.gov, or you can call us at the Central Virginia Alliance for Community Living and we'll work through that with you. Now that you're familiar with Original Medicare and the prescription drug plans, we're going to talk about different choices that you have in how you want to do your Medicare. We'll go over costs, benefits, pros, cons, to the choices that you have. We already know about Part A and Part B. Part A is the inpatient hospital stay. There's no premium, and there's a 60-day period deductible of $1,484 that you'll pay. Part B does have a premium. It's $148.50. The deductible is one time a year, the $203, and then there's a 20-80 split. And there's no limit to that 20%. It will continue going. There's not an out-of-pocket limit with Original Medicare. Sometimes people choose to get what's called a Medigap or a Medicare supplement. A Medicare supplement covers the gaps in Medicare. And by gaps, we're talking about the Part A deductible, and we're talking about the 20% copay that you pay for Medicare Part B services after the deductible. The average cost of a Medicare supplement at age 65 is going to be somewhere between $88 and $100 a month. And Medicare is always per individual. Sometimes companies, and these are done by private companies, sometimes they'll give you a family discount if you and your spouse both have insurance with that company. but the average cost is between $88 and $100 a month. Those costs, for the most part, are based upon your age. And so what you're going to get every year as a birthday present is a rate increase. And those increases aren't willy-nilly, and they're not decided just based on how much money the insurance company wants, but that's pretty tightly regulated by the Bureau of Insurance. And the insurance company needs to show that they have spent enough money that it justifies an increase in the rate. Actually, that's not true. The average monthly cost of a Medicare supplement is going to be somewhere between $88 and $100 a month, depending on the company that you buy the plan with. Most of these companies are base their premiums on your age, and so your birthday present every year is going to be a rate increase based on your age. They are also allowed to increase your premiums once a year based on their experience. These companies are private companies, but they're tightly regulated by the Bureau of Insurance, and they need to prove that they have spent enough money to justify a rate increase. Some years they may have a rate decrease. I've seen them both happen. But just be aware of where the starting point is and that those costs will rise over time. Each of these Medicare supplement plans are standardized. And what I mean by that is that they cover the same thing. So for example, a G plan is a plan that people often get these days. And a G plan covers exactly what I just described to you. It covers the Part A premium and it covers the Part B 20% deductible. Those are the benefits of the plan, and it doesn't matter what company you buy it from. Those are the benefits. The only way they're going to differ is in what the monthly cost or monthly premium is going to be. So that makes it a little bit easier to shop for a Medicare supplement because you know that the benefits are all the same. They only differ in cost. A Medicare supplement works with Medicare. Medicare is primary, and it's going to cover all the benefits that we've already discussed. The Medicare supplement is secondary, and its only job is to pick up those costs, the deductible and the copay that we talked about. A Medicare supplement can be used anywhere that Medicare is accepted. There are no networks. If you decide that you want to go to Duke or you want to go to the Mayo Clinic and they accept Medicare, they're going to accept your Medicare supplement. So it's very versatile in that you can take it with you. If you spend 6 months in Florida and 6 months in Virginia, you can take it with you and you know that it's going to cover the cost. There are no networks that you need to keep up with. If you have a Medigap plan, you're also going to want to get a prescription drug plan because remember, original Medicare does not cover prescription drugs. So you would have a separate prescription drug plan. And the average cost of a prescription drug plan is about $30 a month. We've already talked about the Medicare.gov search that you can do for your plan, and those plans can be changed every year between October 15th and December 7th. The Medigap plan, on the other hand, there is no enrollment period for the Medigap yearly, but once you get the Medigap, you're going to want to keep it. That is not something that you typically shop yearly for. The one thing you need to be aware of when buying a Medigap plan is there is something called a Medigap guaranteed issue period. And that guaranteed issue period begins when you get your Part B, and it extends for 6 months. And during that 6-month period, you are guaranteed to be sold a Medigap plan at the same cost as anyone else. So you could have pre-existing conditions, diabetes, insulin, you could be on dialysis, you could have any kind of condition that the insurance company is not allowed to ask you about. They must sell you the Medigap plan at the same cost as anyone else during that 6-month period. After that and on, the insurance companies can underwrite you. And that means they can ask you questions about your health. They can ask you any kind of pre-existing conditions you have, what medications you're taking, and then they can rate you and set the cost of that plan based on your conditions. Or they can deny the coverage altogether. So it's important as you're deciding what you want to do to know that during these first 6 months you can buy the policy with no questions asked, but you will be underwritten later on. So that's something to keep in mind when you're making the decision when you're first going on Medicare, which direction you want to go. So with a Medigap plan, you will have the cost of the premium. You'll have the cost of the plan itself, somewhere between $88 and $100, and you'll have the cost of the prescription drug plan. And those will be your total out-of-pocket costs. So what's the other way of doing Medicare? You hear these commercials, you see all these extra benefits, you see all sorts of things that you may be eligible for. And what those are talking about is Part C, or a Medicare Advantage plan. With the Medicare Advantage plan, you still have your Part A and your Part B and your Part D. And they are packaged all together in one plan. These are HMOs or PPOs, a lot like traditional insurance is. It's managed care. The local companies that sell them are Humana, Optima, United Healthcare, and Anthem. And those come with a local network of doctors. So you would want to stay within the doctors that are in their network, and you would have to check with each of these individual plans to see what doctors are in their network. And it's important to stay within that network because it can get expensive otherwise. The premiums are somewhere between $0 and $100, and there are a lot of plans that you don't pay any extra for. You still have to pay your $148.50 for Part B, but in many cases that's the only premium that you'll pay. Instead of having a 20% copay and deductibles the way you do with original Medicare, with an Advantage plan you have standard copays for the services. So while your primary care doctor may not have any copay at all, a specialist might have a $50 copay. Instead of the standard deductible with original Medicare, when you go in the hospital, you might have a $350 a day copay for the first 5 days when you go into the hospital. You might have a $30 copay for each visit to rehab. You might have a limit to the number of days that it pays in a skilled nursing care facility. So there are different rules, but you pay as you go, and you pay as you use the services. There is a maximum out of pocket with most of these, and that would be somewhere between $5,500 and $7,600 a year. Once you hit that maximum out of pocket, then the plan will pay 100%. Many of these plans have started offering extra benefits like dental coverage, eye coverage, hearing coverage, and it would be important to look into exactly what the plans offer before you chose which plan you wanted to go to. And again, with each of those, you need to stay within the network of doctors that they are with. An Advantage plan will also include prescription drug coverage with their plans. So let's compare the two with the coverage that you get and the costs involved. So with original Medicare and a Medicare supplement, you still pay the Part B premium of $148, and you get a prescription drug plan. It's about $30. The average premium for a Medicare supplement or a Medigap plan is about $90. So the total is going to come to around $270 a month for your coverage. Remember, that is what your total out-of-pocket is going to be. You have the $200 a year deductible. After you pay that, you're done. No matter what happens to you during that year, your medical costs are going to be taken care of. There will be no surprises, and you know exactly how much you're going to spend each month on your medical cost. The only unknowable thing right now is the cost of your medicines, and you can certainly find that out on Medicare.gov. So with a Medicare Advantage plan, you still pay the $148 premium. The average Part C premium is going to be anywhere between $0 and $84. We're going to call it $25. The unknown here, in addition to the cost of your medications, is the copays. How much you'll pay for your doctor's services. Since it's pay as you go, if you don't use any doctor's services, you don't pay anything. But should you end up in the hospital or should you have multiple doctor visits a year, those can add up, and you need to take that into consideration. So the total monthly cost of a Medicare Advantage plan will be approximately $170. But with that, remember that you have the unknowns of what your medical costs will be and how much your prescription medications will be. So to wind things up, let's take a look at the two choices side by side, the Medigap plan and the Medicare Advantage plan. We looked at the cost. These are the benefits side by side. Original Medicare plus a Medigap plan is going to have higher premiums but no co-payments. You'll have freedom to choose any doctor you want. Anywhere that takes Medicare will take your Medicare Gap plan. You don't need referrals to see specialists. There are some routine visits that are not going to be covered, the vision and hearing, and you would either need to pay those out of pocket or get a plan to cover that. And you can be covered anywhere in the United States. With the Medicare Advantage plan, the premiums are lower, sometimes $0, but it has co-payments. You pay as you go. You might be restricted to a network of doctors, of local doctors, and may need a referral for specialists, especially if you're in an HMO. It may include extra benefits. It might include vision, hearing, fitness. A number of extra benefits may be included with it. The only services that you will get outside the service area would be for emergencies. If you step on a piece of glass while you're at the beach, if you have a true emergency, and the plan decides if it's an emergency or not, then the plan will pay for it outside of the service area. So I hope you feel like you know a little bit more about Medicare, about how it works, about what the costs are, and what your choices are. We're happy to help. We're happy to walk through this and look at your specific situation. We have a great group of volunteers who have been trained and certified and who have been doing this for years and years, are experts in the field. So call us. Any of us will be able to help you make the choices that you need.